A chilly fall afternoon in 2021, a woman named Ruth Jones pushed her grandson's stroller through the Boston Common, a beautiful city park in Boston, Massachusetts. Ruth beamed with pride as people leaned in to get a look at 8-week-old Tommy, who was cooing and gurgling in his stroller. This was one of Tommy's very first excursions outside of the house, and he was bundled up so much that he almost looked like a little burrito with big brown eyes, fascinated by the treetops overhead and all the new faces waving hello. Ruth walked them around the pond, marveling at all the autumn foliage in the park, then sat down on a bench across from her favorite people-watching spot, the vintage carousel with hand-painted wooden horses and zebras. She turned Tommy's stroller so he could see the flashing lights and hear the lively organ music, but after a moment, Tommy started to cry. And so Ruth turned Tommy around and tried to calm him down, but it was like nothing she could do could get the boy to stop crying. Ruth's daughter Emily had warned her that Tommy had been very irritable lately. So she picked Tommy up out of the stroller and cradled him to her chest, thinking that might calm him down. But he just continued to wail in her arms, almost like he was actually in pain. Ruth then tried to give Tommy a pacifier, something he normally liked, but he wouldn't take it. And if anything, it just seemed to make him even more upset. Ruth wondered if maybe he was hungry, but she didn't have a bottle with her, so she decided it was time to take Tommy home. Tommy cried the entire way back. By the time Ruth got him to her daughter's house, his voice was hoarse. Now, at this point, Ruth did feel very sorry for Tommy. She didn't know what was going on, and obviously he was very upset. But if she was being honest, all this persistent crying was actually now giving Ruth a bit of a headache. And so she carefully brought Tommy into the kitchen, and she put the kettle on the stove for tea, and then put Tommy's bottle in a warmer. And while the milk was warming, she set out a teacup, put a tea bag in, and also got some honey out. All the while, Tommy just continued to wail and cry on her shoulder. Once Tommy's bottle was warm, Ruth tried to give it to him, but he was so upset he wouldn't take it. And so now Ruth was sort of out of ideas and really didn't know how to calm Tommy down. And so she just began walking around the kitchen, patting her grandson on the back and, doing everything she could to be motherly, but Tommy just kept on wailing and wailing. And then Ruth remembered that her daughter and son-in-law had said something about giving Tommy something sweet when he had been really upset these past couple of weeks. But Ruth looked around the kitchen and couldn't find anything that fit the description and didn't feel comfortable just giving him something random. And so ultimately, Ruth just sort of walked around the kitchen as Tommy screamed for the next few hours until finally Ruth's daughter Emily came home and took Tommy from her. 6 days later, Ruth was at Tommy's pediatrician's office, holding the crying baby to her chest while trying to fill out a clipboard of check-in forms. Over the past week, Tommy's meltdowns had gotten longer, louder, and more frequent. Ruth and Emily were both worried that something was genuinely wrong with him, and so Emily had scheduled this doctor's appointment for Tommy. But today, Emily had to work, and so Ruth had taken the baby. When they finally got called back to the examination room, Tommy's crying only seemed to get worse. And so the pediatrician, upon seeing Tommy, sort of furrowed her brow as she began conducting a routine physical exam. And as she did, Ruth explained that these crying fits had been going on like this for a full week. The pediatrician nodded as she touched the right side of Tommy's abdomen. And as she did, Tommy wailed harder and louder than Ruth had ever heard. She jumped to her feet out of instinct, genuinely horrified by the noise coming from her grandson. But the pediatrician just shook her head and said not to worry. She now knew what the problem was. There was gas stuck in his tiny stomach. The pediatrician then showed Ruth some exercises to do on Tommy, and she literally began pedaling Tommy's legs and folding them up and down and rubbing his stomach to help him pass the gas. And as she did that, in demonstration for Ruth, it did seem like Tommy was calming down just a little bit. However, by the time Ruth and Tommy were back home again, Tommy was wailing all over again. And so Ruth carried him up to the nursery and ran him through all those exercises she had been shown on his changing table, and he did pass some gas and he did start to quiet down. And for a second, Ruth felt relieved, like they were onto something, that they had really figured out what was wrong here, and they were slowly making it better. But the second she picked Tommy up again, he started to cry again. Ruth was at a loss. She just couldn't seem to keep him calm. She paced the hallway with him, and she also just stopped and rocked him back and forth. She carried him up and down the stairs. She sang lullabies, but nothing worked. A few hours later, when Emily got home from work, Ruth almost cried with relief. She handed Tommy off to Emily the moment her daughter stepped through the door. Ruth was obviously still very concerned for Tommy, but she also desperately needed a break from the constant crying. It had just gotten worse all afternoon. His screaming was relentless. And now, as she walked outside down towards her car, she could still hear him crying in the house. And as Ruth drove back to her home, all she could think about is what's going on with Tommy. Half an hour later, back at Emily's house, Emily sat in the nursery with Tommy trying to feed him. Downstairs, she could hear her husband Dave in the kitchen making dinner. And even though Emily was hungry, she knew she had to give Tommy his own dinner before she could eat. And that was proving much more difficult than usual. Now, Tommy had always been a fussy baby, but nothing like the last week. The only time Emily noticed her son seemed even remotely calmed down and happy was when he was nursing, or when they dabbed a trace of honey on his pacifier and actually got him to use it. And so Emily rocked Tommy, and finally he did latch on, and he began breastfeeding, and at that point he did sort of quiet down. Except as he was eating, Emily noticed that he was not latching onto her breast as firmly as he usually did. As the minutes went by, she noticed that he seemed to be drinking less and less milk too. She wondered if maybe it was just because he was so tired from all the crying. A minute later, he'd stopped drinking completely and was fast asleep. Emily thought that maybe he wasn't all that hungry, so she put him in his crib and joined Dave downstairs for dinner. The next morning, just before dawn, Emily was back in Tommy's nursery, back in the armchair she used for nursing, but Tommy was not latching. No matter what she did, she could not get him to begin to breastfeed. Not even in the weak way he'd done the night before. It was just like he wasn't doing it. She knew Tommy had to be hungry, but she had no idea how to get him to actually eat. At this point, Emily felt like Tommy's behavior was more than just typical baby fussiness. And so when her husband appeared in the doorway a moment later, she told him they had to go to the emergency room. A few hours later, Dr. Ann Brogdon walked down the hallway of her Boston area pediatric hospital. She could hear her new patient screaming from inside the small examination room. And when she walked inside, she saw the patient's parents, Emily and Dave, who told Dr. Brogdon that their son, Tommy, had basically been crying nonstop for days. Dr. Brogdon went straight to work. She knew that Emily and Dave were new parents, and so she really wanted to put them at ease, because Dr. Brogdon assumed this was just, child fussiness. So she gave Tommy a routine physical examination, checking his reflexes and taking his vitals. And as she gently poked and prodded him, she asked Emily about his medical history. And everything Emily said sounded typical and healthy. She told the doctor that she'd had a routine vaginal delivery after an equally normal pregnancy. Tommy had no known allergies, and he wasn't on any medications except for vitamin D supplements. He was also still wetting his diapers regularly, though his last bowel movement had been 2 days earlier. Tommy didn't have all of his immunizations just yet, so he was susceptible to pneumonia, influenza type B, and whooping cough, but Tommy's symptoms seemed more like a gastrointestinal problem than any of those diseases. And unfortunately, Dr. Brogdon's physical examination wasn't giving her any real clues either. And so she told Tommy's parents that she would just have to conduct a little bit more testing. An hour or so later, Dr. Brogdon looked at Tommy's test results on her tablet. Tommy had tested negative for a whole bunch of diseases, RSV, influenza types A and B, and even COVID. So his distress probably was not caused by a viral infection. Tommy's blood levels were also all normal, which ruled out other things like appendicitis, pancreatitis, liver disease, or some kind of obstruction in his digestive system. Dr. Brogdon's physical exam had also already ruled out the possibility of child abuse, and it was unlikely that a breastfeeding infant could have ingested poison. So what was going on here? Dr. Brogdon decided to ramp up her efforts. Something was obviously wrong with Tommy, and it couldn't just be a case of bad gas. So she ordered a urinalysis, an ultrasound of his abdomen, and an X-ray of his chest. She hoped one of those more advanced tests might finally solve the mystery around what was going on with Tommy. When Dr. Brogdon opened the door to Tommy's room an hour later, the sound of his wailing immediately filled the hallway. And inside the room, Emily was pacing back and forth with Tommy in her arms as his screams echoed off the walls. Emily and Dave looked utterly miserable, totally sleep-deprived and confused and nervous, and unfortunately, Dr. Brogdon didn't have anything really positive to say, which only made it that much harder to deliver the news. She still didn't know what was wrong with their son. His chest x-ray came back normal, his ultrasound and urinalysis were also normal, and yet he was still crying. Emily and Dave were heartbroken. They couldn't believe that nobody knew what to do here. But Dr. Brogdon promised them she was doing everything she could to help, and then she told Emily and Dave that she was going to admit Tommy to the hospital. Four hours later, one of the hospital's pediatricians, Dr. Christopher Reynolds, entered Tommy's hospital room. He'd read in the clinical notes that Tommy had been crying for days, so he was surprised to find that the room was actually silent when he walked in. Emily and Dave were inside the room sitting on the bed. Dave was holding Tommy, who was nearly asleep. After more than 6 hours of uninterrupted crying, it seemed like the little boy had finally tired himself out. Dr. Reynolds hoped that was a good sign. The doctor introduced himself and reached for the baby to do a physical exam. He'd already scanned Tommy's case file and knew that despite crying for days, Tommy was mentally alert. But when Dr. Reynolds took Tommy and fully woke him up and tried to get his attention, he noticed that Tommy did not seem to focus on him. At first, he wondered if maybe it was because the boy was just so sleepy, but the more he examined the child, the more he began to realize that Tommy seemed to have no energy at all, and his reflexes were quite slow. It was like his reactions were on a time delay. Dr. Reynolds knew Tommy had to be tired, but this was something else. Dr. Reynolds immediately ordered an MRI to see if there was something wrong with the child's internal organs. And fortunately, that scan showed no abnormalities, but it meant Dr. Reynolds had to order more testing to figure out what was actually going on here. He told Emily and Dave that he wanted to test Tommy's next stool sample. And in the meantime, he also wanted to perform a lumbar puncture or spinal tap just to make sure that Tommy was not suffering from an infection in his brain or spinal cord. The spinal tap procedure did not take very long, but Dr. Reynolds knew it was very difficult for Emily and Dave to watch. The doctor had placed Tommy in the fetal position on his side and then inserted a long needle into his spine to draw out the spinal fluid. And even though he had placed numbing cream on the injection site, Tommy's cries were still ear-splitting the instant the needle broke the skin. Thankfully, it was all over in just a few minutes. Once Dr. Reynolds had the spinal fluid sample, he sent it for testing right away. And this time, Dr. Reynolds did get a useful clue. The spinal fluid analysis showed an elevated protein count, which could mean Tommy's body was working overtime to fight off some kind of infection. But since they had already ruled out a lot of the more common infections, Dr. Reynolds was now worried that Tommy might have meningitis, or inflammation in the brain. Bacterial meningitis, especially in children, is extremely dangerous. It can cause long-term problems with seizures, brain damage. It can even be fatal. And so even though the doctor didn't know specifically what kind of infection the baby was fighting, what he did right away was just put Tommy on antibiotics to try to kill whatever bacteria was causing the infection. About an hour later, Dr. Reynolds checked in on Tommy to see if the antibiotics were kicking in. But as soon as he examined the little boy, he could see there was a big problem. Tommy was really struggling to breathe, and whenever he breathed in, it almost sounded like he was grunting. In fact, Tommy was fighting so hard for oxygen that Dr. Reynolds could see his ribcage straining against his skin with every breath. And there was a faint blue tint growing around Tommy's lips, which truly scared Dr. Reynolds, because that meant the baby was not getting enough oxygen. And so he immediately put Tommy on supplemental oxygen and instructed the nurses to rush him to the intensive care unit. Moments later, the hospital's pediatric critical care specialist, Dr. Cassandra Pierce, examined Tommy in the pediatric ICU while his parents, Emily and Dave, stood by at the foot of his hospital crib. Dr. Pierce thought Tommy's cry was more weak and pained, and in fact, it sounded more like a snore than a wail, like it was taking everything out of him just to make a sound. To Dr. Pierce, that was a sign of an airway obstruction. So she turned Tommy onto his back, and when she did, she noticed his eyelids were drooping and his head sort of bobbed strangely up and down on his neck. Dr. Pierce knew she had to act quickly, and so she called for an intubation kit, and right away a nurse came back with one. Then Dr. Pierce took the hollow tube and slid it down Tommy's throat past his vocal cords, all the while Tommy was jerking in discomfort trying to pull away. But once the tube was all the way in and Tommy stopped thrashing, Dr. Pierce hooked it up to a ventilator, a machine that would now breathe for Tommy, so his body could rest and get the oxygen it desperately needed. But even as the child's chest began to rise and fall in a steadier pattern, Dr. Pierce knew Tommy's lungs were still at risk to collapse. But just then, the heart rate monitor by Tommy's bedside began beeping. Tommy's heart began beating much faster than normal. Then another monitor began going off, signaling that Tommy's blood pressure was rising too. It was like his entire body was panicking, even though he was lying there quietly. Thinking fast, Dr. Pierce turned to the nurse and asked her to start Tommy on continuous infusions of opioids and drugs called benzodiazepines, which would hopefully get his body to relax and relieve his pain until she could figure out what was going on. Also, Dr. Reynolds administered Tommy a sedative and lower-dose painkiller. An hour later, Dr. Reynolds was leaning over Tommy, testing his reflexes, and they remained very weak. In fact, overall, Tommy was just growing weaker by the minute. Further analysis had been conducted on Tommy's spinal fluid, and it had come back negative for meningitis. On the one hand, Dr. Reynolds and the rest of the medical team were relieved that the boy did not have meningitis. But on the other hand, at this point, they still just didn't have a diagnosis for Tommy, which was making caring for him nearly impossible. It's like in some ways just having a diagnosis, even a bad one, would sort of be an improvement. They'd at least have the ability to try to treat something. But without a diagnosis, they were just sort of left scratching their heads. Dr. Reynolds went back to Tommy's medical history and looked for anything that somebody might have missed. But there was nothing that stood out. The child had no neurological deficits, he had no swelling in his heart or lungs, there were no gastrointestinal issues or urinary issues. On paper, Tommy should be fine. And yet, he continued to get sicker. In fact, he was now developing something called hypotonia, or severe muscle weakness. Something was clearly slowly paralyzing Tommy. But when Dr. Reynolds reviewed Tommy's brain scan, it showed nothing abnormal, which meant that whatever was weakening his muscles probably wasn't affecting his brain or spinal cord. Now, Dr. Reynolds knew he could diagnose Tommy with something called spinal muscular atrophy, a degenerative motor neuron disease that weakens the muscles closest to the center of the body. That would explain Tommy's overall weakness, his drooping eyelids, and his inability to latch when his mother tried to breastfeed him. It was also one of the more common genetic disorders in young kids. But deep down, Dr. Reynolds knew that diagnosis did not explain all of Tommy's symptoms, including the high protein levels in Tommy's spinal cord fluid. Then he thought Tommy's high protein levels and growing muscle weakness could be a sign of Guillain-Barré syndrome, a condition caused when the immune system attacks the nervous system and weakens the muscles. But Dr. Reynolds knew that that syndrome was very rare in babies. Dr. Reynolds paced the hallway outside of Tommy's room, trying to think if there was anything he hadn't thought of or some question he hadn't asked. And then he realized there actually was one question he had not personally asked the parents yet. And so he dashed back down the hallway to Tommy's room, he went inside, and he asked Emily and Dave, who were at their son's bedside, what had they fed their son in the past few weeks? Now, keep in mind, Tommy was breastfed, and so the assumption was he only got milk. But Dr. Reynolds was wondering if maybe this child had eaten something other than milk. But Emily looked up at Dr. Reynolds and just told the doctor that, yeah, Tommy is breastfed, and he's only had her milk. Dr. Reynolds felt defeated. For a second, he felt like maybe he had just solved what Tommy's issues were. Maybe it was coming from eating something that was not his mother's milk. However, just then, Tommy's father, Dave, added that on occasion, when Tommy would not take his pacifier, they would sweeten it with a drop of honey. Suddenly, it all made sense, and Dr. Reynolds knew what was wrong with Tommy. But it was a terrible diagnosis, and there was no time to waste. Tommy needed emergency treatment right away, even before the diagnosis was confirmed. The second Dave had said they fed their baby honey on occasion, Dr. Reynolds realized that Tommy had something called botulism. Botulism is a rare but serious illness caused by a bacterial toxin that attacks the nervous system. As the disease progresses, it causes difficulty breathing, muscle paralysis, and sometimes even death. Adults can typically fight off botulism, but babies, like Tommy, are not capable of overcoming the bacteria that spreads it. About 90% of untreated infant botulism cases are fatal. While botulism is rare, the bacteria that causes it is not. In fact, it's found in many kitchens, often hiding in an unlikely place: honey. Honey is a natural sweetener, but it should never be given to babies under the age of 1 for this reason. Unfortunately, Dave and Emily didn't know this, and when they dipped Tommy's pacifier in honey to sweeten it, they had unknowingly made their baby very sick. Dr. Reynolds sent Tommy's stool sample out for testing, knowing that it would take 6 days for the results to come back. But he was so sure about the botulism diagnosis that he just started Tommy on a special antitoxin treatment right away. Over the next 10 days, Tommy slowly regained movement in his arms and legs, and his botulism diagnosis was confirmed. It would still take another 20 days or so before he was well enough to be discharged from the hospital, and then once he was discharged, he had to spend 8 more days at a rehab facility. However, at the end of it all, he would make a full recovery, and he is doing well today. And now, here's our first story called Just Like the Movies. On a cold fall morning in 1999, 51-year-old Martin Henry walked across the linoleum flooring at the Glister Mary Lee popcorn plant in Jasper, Missouri. The fluorescent lights overhead glinted on all the stainless steel machinery that covered the manufacturing floor. Workers bustled around their stations, already hard at work despite the early hour. A young man followed behind Martin as he walked the plant floor. He was a new hire, and he was taking notes as Martin pointed at different machines and explained how they worked. He gestured at the dozens of employees working all around the room and jokingly told the new guy that he should try to meet everybody. The new guy just started laughing. That's because the new guy knew everybody here already. Jasper was a town of just 1,000 people, and the popcorn factory employed about 15% of them. Martin had instantly recognized the new guy from around town the moment he had showed up that day. Martin led the new hire over to the workstation that he knew best, the mixer room where he had worked for most of the past 2 years. Martin manned the machine that coated each popcorn kernel with buttery flavoring. He liked to think of himself as the guy who made the popcorn taste just like it did at the movies. Martin took a keyring out of his pocket and turned on the mixing machines. A moment later, a puff of yellow mist leaked out of the top of the largest mixer, and right away this wonderful buttery scent filled the air. Martin peeled off his rubber gloves and grabbed a new pair. Then he showed the new guy how to work all the different buttons and toggles in the mixing room and what the different level readings meant. Then he pressed a few buttons, and the machine hummed into action. Martin stepped aside and told his new trainee to give the mixers a try. So the young man turned on the spigot on one of the 2 smaller mixing tanks, letting butter flavoring pour out into a plastic 5-gallon bucket. As Martin stood there with his hands on his hips, he felt proud of his work. But he also felt distracted because his arms felt so dry and itchy. They had been that way all week, something he blamed on the changing weather. He was glad that his thick rubber gloves and long-sleeved white coat prevented him from scratching. Otherwise, he feared he might scratch himself bloody. But after only a few minutes of standing there, Martin just couldn't stand the itching any longer. So he excused himself from the new hire and then hustled over to the locker room where he could scratch himself to his heart's content and douse himself in more lotion. A few months later, Martin's wife, Linda Henry, rolled out of bed and began walking over to the bathroom she shared with her husband. As she did, she heard her husband moving, and she turned and saw him roll over in bed and reach for the phone on the nightstand. To protect his skin, Martin's hands were actually wrapped in plastic bags, which crinkled as he punched in the phone number he was trying to press. He was calling into work, letting them know he needed a sick day to deal with his ongoing skin problem. She heard him say that the pain was unbearable, which to her seemed like an understatement. Linda walked into the bathroom and opened up the medicine cabinet and grabbed a half-empty jar of Vaseline. For the past few weeks, her husband's hands had been so chapped and flaky that Linda had been coating them in Vaseline and then wrapping them in those plastic bags while he slept, both to prevent scratching and to keep the skin from falling off onto their sheets. For the past couple of weeks, the skin on Martin's hands and legs had gotten so papery and ashen that it had started falling off in 2 to 3 inch chunks. Now, historically, Martin did typically get dry hands in the winter, but it had never gotten this bad before. Linda couldn't imagine what might be causing this severe skin condition, but she was very worried about her husband. He seemed to always be in pain. At first, she blamed his job at the factory. Constant hand washing and changing rubber gloves and cleaning the machines with harsh chemicals couldn't be doing him any favors. But Martin assured her that none of his symptoms got worse while he was at work, and they didn't improve while he was home. Besides, none of the other employees had developed skin conditions. Now, Martin's reasoning made enough sense, but now, as Linda helped Martin remove the bags from his Vaseline-covered hands, it was clear, at least to her, that something was terribly wrong here, and almost certainly it had to do with his job. I mean, what else could it be? And so after saying as much to her husband, Martin finally relented and said that he would file for workers' compensation insurance, claiming he had developed the skin disease from work. 2 months later, Linda was just about to start making dinner when she heard the mail fall through the slot in their front door. Her eyes widened when she saw it was an envelope from the factory's insurance company. She hoped it was good news about her husband's workers' compensation. She carried the envelope into the living room where Martin was sitting back in his easy chair. His hands were covered in bloody red patches where his skin had fallen off. But now, Martin had more to worry about than just a skin disease. Over the past few weeks, Martin had also developed severe difficulty breathing, which really frightened Linda. He'd gone to the doctor, but the doctor said very likely his shortness of breath was unconnected to whatever was going on with his dry skin. The doctor said his breathing issue seemed like a standard case of bronchitis, or maybe he'd developed asthma. But none of the medicines the doctor prescribed for these conditions had helped Martin's breathing. And so Martin spent most days coughing and wheezing and sometimes even gasping for air. He could barely get up the stairs to their bedroom at night. The recliner was the only place he felt somewhat comfortable. When Linda entered the room, she could see her husband was asleep in the chair. She could hear his soft wheezing. But she felt like this envelope was worth waking him up for. They really needed some good news, and this could be it. So she walked over and tapped gently on her husband's shoulder, and he opened his eyes and immediately just began hacking and coughing, as always. Linda handed him the letter, and when he saw what it was, his eyes went wide. He was eager to see what it would say. By this point, because of Martin's medical issues, he basically didn't leave the house anymore, and he hadn't gone back to work ever since that day he called in sick 2 months earlier. And he and his wife were just at a loss. They couldn't understand how Martin, a seemingly healthy 51-year-old man, could become this sick so quickly. And out of the two of them, Linda was also very convinced that whatever was going on with him really did have to do with his job. It had to be the cause. Also, by now, rumors were starting to spread that other workers at the factory had also become ill. Although they didn't seem as bad off as Martin, their symptoms were similar: wheezing cough, trouble breathing, and this horrible skin rash. And so as Linda watched her now very frail husband open up this envelope, causing bits of his skin to flake off and fall to the carpet, she hoped the other men from the factory would also apply for workers' compensation too, because clearly something was terribly wrong at that factory. Linda watched Martin take the sheet of paper out of the envelope and read it over. Then Martin cursed and told her bitterly that his workers' compensation claim had been denied. The company's doctor had evaluated Martin before his breathing problems started, and so the only thing he had been evaluated for was his skin condition. And there wasn't enough evidence to prove his dry, flaking skin was caused by conditions at the factory. And so if Martin and Linda were going to get some financial help, it would have to come from somewhere else. A few weeks later, in April of 2000, Dr. Thomas Carter reviewed some paperwork at his desk in Kansas City, Missouri. Dr. Carter was an occupational health physician, and he'd been alerted to the strange medical cases coming out of the popcorn plant in Joplin. Over the past few weeks, Dr. Carter had interviewed Martin, along with 7 other popcorn factory workers, all of them struggling to breathe and suffering rashes all over their bodies. He now had medical records for all 8 workers, and the details had shocked him. All 8 had been given different diagnoses, like asthma, bronchitis, and emphysema, but their symptoms were almost identical. All 8 men were struggling to get air into their lungs, and medication had been ineffective in treating their symptoms. One of the workers was 44 years old, but his lung capacity had been reduced to that of a small child. Given all the evidence, Dr. Carter had drawn a chilling conclusion. In his opinion, Martin and the 7 other workers had a rare but often fatal lung disease called bronchiolitis obliterans, which literally meant the obliteration of the lung's airways. Most people with this condition die within 5 years as their airways become increasingly inflamed and then scarred, making breathing extremely difficult. It can also cause the painful skin condition Martin was experiencing, although many doctors don't make the connection. And so while Martin and his co-workers were grateful to now have this information about what was happening to their bodies, at the same time, they were devastated. This condition they had was irreversible, and unless they got a lung transplant, they would die. In all of Dr. Carter's 25-year career, he'd only ever seen this disease 3 times. And now, there were 8 cases in a single town of only 1,000 people, and all 8 of those people worked at the same factory. Those were epidemic-level numbers. And so Dr. Carter picked up the phone and called the Missouri Department of Health and Human Services. 6 months later, in November of 2000, Dr. Rebecca Roberts stood on the factory floor at the popcorn plant, watching several factory workers breathe into small plastic devices called spirometers. Dr. Roberts had flown into Jasper the night before from Washington, D.C. She worked at the National Institute for Occupational Safety and Health, and this popcorn facility had been on her radar for a while now. Over the summer, Dr. Roberts and her team had learned about the 8 factory workers who had developed the terrible respiratory disease called bronchiolitis obliterans. She also knew that investigators from another agency, the Occupational Safety and Health Administration, or OSHA, had inspected the popcorn facility. But the OSHA investigators didn't find any health or safety violations. But despite their findings, Dr. Roberts just couldn't get around the idea that there had to be some connection to this factory. I mean, the idea that 8 workers all at the same plant all developed the same rare lung disease, it couldn't be coincidence. So that August and September, she had personally conducted 2 walkthrough investigations of the popcorn plant. Now, during those visits, Dr. Roberts had not spotted any obvious red flags. But she still was not convinced that this factory was safe. So she had decided to return to the factory one more time, and this time she brought a medical team to do a more detailed survey. Today, her team was interviewing workers at the factory and using these spirometers to measure their breathing. While Dr. Roberts' team talked to workers on the main factory floor, she turned her attention to the mixing room, where Martin once worked. There was only one man in the mixing room, moving buckets of butter flavoring from one vat to another. When Dr. Roberts introduced herself, he shook her hand and said that his name was Simon. Then he began to cough into the crook of his elbow, and as he did, he kind of shook his head, cursing under his breath. Dr. Roberts asked him if he was coming down with something. Simon told her he'd had a cough for a while now. He laughed and said it actually helped him fit in, because pretty much everybody who worked in the mixing and packaging rooms had asthma or bronchitis or something like that, and so everybody was coughing all the time. After this short conversation, Dr. Roberts climbed up a nearby metal staircase to the mezzanine, which looked out over the mixing room. There were a few men working there, and she quickly waved them over. A tall guy with a hairnet came over first, and Dr. Roberts asked him if he had breathing problems too. The man nodded and said the doctors diagnosed him with asthma. He said he'd developed it over the past year, but for whatever reason, asthma medications did not seem to help at all. By the time Dr. Roberts left the factory an hour later, she had no doubt that there had to be a serious health problem at the Glister Mary Lee popcorn plant, and that it very likely started in the mixing room. But she still could not pinpoint exactly what the problem was. So she decided that investigators would need to visit the factory one more time. And this time, they'd take samples of everything. The popcorn, the flavoring mixtures, the cleaning products, and any hint of dust or mold. Whatever was in there making these workers sick, she was determined to find it. A few weeks later, inside of a lab, Dr. Roberts, along with 2 lab researchers, stared into a big plastic rodent cage full of rats that they were using in an experiment. Dr. Roberts and her team had tested all the samples they had collected from the popcorn plant. They'd identified 100 different potentially toxic compounds in those samples, but none of them seemed to be what was making people sick. Dr. Roberts had been very frustrated, but she did have one more idea. There was one more chemical that she wanted to test on the rats. This chemical was normally considered to be safe to eat, but there had been very little research done on what would happen if someone inhaled it. And sure enough, after the rats breathed in a large amount of the chemical, their breathing became shallow and labored. Later, when examined under a microscope, their lungs were revealed to be inflamed and scarred, just like human victims of bronchiolitis obliterans. Dr. Roberts finally had her answer. This seemingly innocent chemical was causing the disease plaguing Martin and the other workers. The tests that Dr. Roberts and her team did proved that it was the delicious-smelling butter-flavoring mixture that was making the workers sick. Specifically, a chemical in the mixture called diacetyl. Diacetyl is a naturally occurring substance found in things like beer, butter, cheese, and coffee, and it can be used as artificial flavoring. No one suspected diacetyl because the Food and Drug Administration, or FDA, had already determined it was safe to eat. But Dr. Roberts realized the FDA never tested whether diacetyl was safe to breathe, and it definitely was not. And the factory where Martin worked was using 3 times the diacetyl found in most butter flavorings at other factories. The deadly fumes wreaked havoc on employees' skin and lungs, creating irreversible damage. But Martin and his coworkers were not the only popcorn factory workers in danger. In October of 2001, there were 140 popcorn plants in the United States, and they were all using this butter mixture with dangerous levels of diacetyl. Even worse, there were thousands of other businesses that either made or used butter flavoring with diacetyl. That meant thousands of workers nationwide were at risk of developing what came to be called popcorn lung disease. In December of 2003, the National Institute for Occupational Safety and Health issued warnings to more than 4,000 businesses that either made or used this butter flavoring. In response, 80% of American popcorn makers stopped using diacetyl in their butter flavoring and switched to something else. Now, this made current and future workers much safer, but this did nothing to curb the damage that had already been done by the diacetyl poisoning. One of the workers at Martin's factory was awarded $20 million for the damage to his health, and part of that settlement was intended to go to the factory's other victims, including Martin Henry. However, the comfort from that settlement would be short-lived, because Martin would die on May 22, 2010. He was only 62 years old. And now, here's our second story, called Headache from Hell. In the late winter of 2023, 52-year-old Jacob Malloy stretched out in bed. He'd woken up late and was enjoying a lazy Sunday, petting his cat Gizmo, who was splayed out next to him on the bed. Finally, Jacob's stomach started to grumble, so he rolled out of bed and pulled back his curtains. A bright beam of sunshine filled his bedroom with light. He cracked open his window just enough to feel a cool but pleasant breeze sweep through his room. Jacob lived in Orlando, Florida, so even though it was February, it was a mild 60 degrees outside. Jacob heard the coffee maker percolating downstairs, and he knew that it was time to go join his wife Jessica for breakfast. So he went down to the kitchen and quickly invited Jessica to sit at the table while he made them both food. 30 minutes later, Jacob had bacon frying in a cast iron skillet on the stove, while he poured pancake batter onto a searing hot griddle. After a minute, he flipped the pancakes, then he turned back to the stove to take the bacon out of the skillet. He timed it just right. The bacon was still soft and flopped gently onto his plate. He hated when bacon got too crispy. It tasted too dry. He used the grease from the bacon to fry up some hash browns and eggs, then carried 2 loaded plates over to the table. Jessica brought over the pot of coffee and then thanked her husband for the extravagant breakfast. Jacob winked and told Jessica not to tell his doctor. She laughed, but Jacob actually wasn't kidding. He was overweight and had type 2 diabetes, and so his doctor had told him a few times to lay off the greasy food. But Jacob figured what the doctor didn't know wouldn't hurt him. He dipped a forkful of hash browns into the golden yolk from his fried eggs and took a big, satisfying bite. A few weeks later, Jacob was out in the yard mowing the lawn when a sharp pain erupted in his temple. Jacob stopped the mower and beelined for the garage. He got migraines about once a month, so he knew what it felt like when one was coming on. Jacob called out to Jessica as he walked in through the garage door and jogged up the stairs. He got some headache medicine out of his nightstand and took 2 pills before collapsing onto his bed. Within a few minutes, a familiar ache began to pulse behind his temples. But instead of moving forward towards his forehead like usual, the pain seemed to migrate toward the back of his skull. And his migraine medication wasn't helping at all, which was unusual. It was strong stuff, and until now it always seemed to do the trick. And so Jacob had no choice but to just bury his head in a pillow and ride out the pain. Finally, sometime that evening, the throbbing at the base of his skull subsided. It had been a shorter migraine, but so painful it didn't feel like he'd gotten off easy. 4 months later, Jacob sat in his primary care doctor's office, chatting with his physician while a nurse took his blood pressure. She frowned when she read the numbers aloud on the blood pressure sleeve. Jacob's doctor admitted they were a little high, but otherwise his vitals did seem fine. Jacob nodded. He expected a little bit of high blood pressure, given all the greasy food he'd been eating. But it was not high blood pressure that had brought Jacob to the doctors that morning. It was his migraines. Ever since that day he was out mowing his lawn, they'd become more and more frequent. Weekly instead of monthly. And they were really beginning to interfere with his life. Most recently, he'd been spending just about every weekend laid up in bed. The doctor found this very concerning, and he asked if Jacob was experiencing any other symptoms, like seizures or numbness or sensations he couldn't explain. Jacob thought for a moment, but then said no, everything else felt normal. The doctor nodded and told Jacob that he wanted to order a CT scan. If there was something going on in Jacob's brain, the CT scan would show it. An hour later, Jacob and the doctor looked at the CT scan image of Jacob's brain on a computer screen. The doctor pointed to small circular areas in the middle of the scan, and he said that they looked like cysts within the white matter of Jacob's brain. Cysts are tiny fluid-filled sacs. The doctor said cysts in the brain are never good news because they can cause a painful pressure buildup and even vision problems. The doctor explained that his biggest concern amongst the cysts was the cluster of cysts located at the bottom right-hand corner of Jacob's brain. He thought that those could actually be causing Jacob's symptoms, the headaches. Jacob reflexively moved a hand and touched the base of his skull. He told the doctor that actually, now that he thought about it, there had been one change in his migraines besides their frequency. Instead of throbbing right above his eyes the way they normally did, the pain had sort of moved to the back of his skull, to right where that cluster of cysts was located on the CT scan. The doctor told Jacob he was admitting him to the hospital immediately. He suspected that Jacob might have a rare condition called congenital neurological cysts, meaning that these cysts have been present in his head for his entire life. But now they could be growing and pressing against Jacob's brain, causing these intense headaches. If more tests showed that was the case, Jacob would need brain surgery to remove the cysts and stop the pressure. Jacob's breath caught in his throat. The thought of brain surgery terrified him. He asked if he could have a few minutes to call his wife and have her come down to the hospital.
Zaman geçsin of, bugünden çıktım yola. Sevmek her zaman zor.
Later that afternoon, Jacob sat upright in a hospital bed, with Jessica sitting beside him in a chair. A neurologist stood at the foot of the bed, holding a new scan of Jacob's brain on his tablet. He explained that the location and distribution of the cysts in Jacob's brain were unusual. In his opinion, Jacob did not have congenital neurological cysts. Jacob perked up and asked if that meant he didn't need brain surgery. But the doctor said he wasn't sure yet. There was definitely still something in Jacob's brain that shouldn't have been there. Then he began asking Jacob questions about his travel history, whether he'd ever visited a farm, and what his house and living conditions were like. Jacob felt mildly confused, but answered the doctor's questions as best as he could. Neither he nor Jessica traveled very much. The last time they left home was 2 years ago when they'd taken a cruise from Miami to the Bahamas, and he'd never been on a farm. The closest he got to animals was petting his cat, Gizmo. The neurologist asked Jacob to walk him through a normal day in his life, including everything he liked to eat at mealtimes. Jacob was a bit embarrassed, but he admitted to the lavish breakfast that he liked to make on the weekends. Jacob had barely started talking when the neurologist stopped him and told Jacob he'd be right back. Then he hurried out of the room. Jacob was a bit surprised, but it seemed like the doctor had a new idea, and soon enough, the neurologist was back. He informed Jacob that he was ordering a full workup to test for infectious diseases. Jacob nodded, feeling as curious as he was frightened. But the next day, the neurologist gave Jacob a diagnosis that he couldn't have imagined in his wildest dreams. The neurologist confirmed that Jacob did not have brain cysts, and Jacob felt instantly relieved by that. But the neurologist told Jacob to brace himself for the rest of the diagnosis. His migraines were being caused by foreign organisms that had somehow gotten into his brain. The round things that the doctor saw in his brain scan were living creatures, tapeworms to be precise. And the neurologist said they got there because of the fancy breakfasts that Jacob loves so much. Specifically, it had to do with the bacon. Jacob didn't like crispy bacon. He liked soft, chewy bacon, something he told the doctor. But that indicated that the bacon was undercooked. And so the theory was, at some point, some of that undercooked bacon must have been infected with tapeworm larvae, and then those larvae were not killed in the frying pan. Had it been cooked long enough, they would have been. But even so, the neurologist explained that the tapeworms would never have reached Jacob's brain if not for a second problem. The neurologist said that the tapeworm can only infect the brain when someone touches the feces that contain the tapeworm larva. The neurologist suspected that after Jacob ate the tapeworm larva from the undercooked bacon and then had a bowel movement containing the tapeworm larva, he must not have washed his hands properly and then touched his nose or mouth. After that, the larva made its way to Jacob's brain. Thankfully, the problem was treatable. The neurologist put Jacob on a 2-week regimen of antiparasitic and anti-inflammatory medications, which killed the tapeworms in his brain. Once the tapeworms were gone, his migraines improved. And so ultimately, Jacob learned a painful lesson in proper hygiene. From Ballen Studios and Wondery, this is Mr. Ballen's Medical Mysteries, hosted by me, Mr. Ballen. A quick note about our stories. They are all inspired by true events, but we do sometimes use pseudonyms to protect the people involved, and also some details are fictionalized for dramatic purposes. And a reminder, the content in this episode is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This episode was written by Aaron Lan. Our editor is Heather Dundas. Sound design is by Andre Plus. Our senior managing producer is Nick Ryan, and our coordinating producer is Taylor Sniffet.